Good afternoon, ladies, and welcome to the Fever in Children webinar. I'm Kish, and I'll be your host today. I'd like to introduce two phenomenal women. We have Dr. Christine Venter from Intercare Gunumi and Dr. Heloise Wessels from Intercare Silver Lakes. Welcome, doctors, and thank you so much for your time today. By the time your child turns 1, you likely have had to manage a handful of fever episodes, which can be very frightening. Dr. Venter, we'd like to hear from you. When should one worry about your child's fever?
When we talk about a fever, we refer to the elevation of your body's core temperature. This is usually in response to an infection, and this elevation in your body's temperature is a very important part of your immune response, and it helps your body to fight infection. You must always keep the baby's symptoms in mind and the condition of your child, and not just think about the actual reading of the temperature. Some very minor illnesses might cause very high fever, and some serious illnesses might cause only a mild elevation in the temperature, or they might not even cause a fever at all. And then another thing that I just quickly want to mention is that you need to know how to measure the temperature of your baby. Usually when we refer or when we talk about a fever, we usually talk about the rectal temperature, which is the core temperature that you take. So you need to be comfortable to take a rectal temperature, especially if your baby is under 6 months, because that is the most accurate reading. Also, if you take the temperature in the eardrum or on the forehead, that will also be the same reading. You can also take the temperature in the mouth or under the armpit. So if you take a rectal temperature, if you take the temperature in the ear or on the forehead, usually if your temperature is more than 38 degrees, then we will say that is a fever. If you measure the temperature in the mouth, like an oral temperature, then that will be more than 37.8. And then if you measure the temperature under the armpit, that will be 37.4. People always want to know, okay, when should they go to the doctor if their child has a fever? When is it very serious? Should they see the GP or should they go to the emergency room? So they are not like a set rule of like, okay, with this thing you have to go to the emergency room, or with this one you have to go to the GP. But I just made a little guideline just to help you. Again, also, if you feel uncomfortable at all, like it's always better to just phone the doctor or get an opinion if you're not sure. Okay, so I'm just going to list a few things. So if any of these are present, then it is very serious and you need to go to the emergency room as soon as possible, or even phone an ambulance if you're not able to get there by yourself. Okay, so if your child is not moving, if they are too weak to stand up, or if you have a baby that's very floppy, they're like just lying there, they're not doing anything, definitely to the emergency room. If it's difficult to wake your child up, like if they're like extremely drowsy, you're doing anything, they don't want to wake up, then also to the emergency room. If they have trouble breathing, that they're breathing so fast that they can't even like speak in a sentence, or they can't even cry, that's also very serious. If they have like small spots, like blood-colored or purple spots anywhere on their body, also a very serious sign. If you can see that the hands and their feet are very, very cold to touch and it's like pale or turning a little bit blue, it means that their circulation is probably not good and also very serious. So that's another one for the emergency room. If your baby is younger than 4 weeks old and they have a fever, definitely take them because they are at very high risk of having serious bacterial infections.
Dr. Wessels, how would you go about treating fever in children?
Thank you. I think, like Dr. Christine said, it's important to note that fever is, rather than something to be too concerned about, it is a sign of something. So it's not necessarily the fever that's the problem, but it is why they have a fever that we need to figure out. But once there is a fever, it is also good to know that the fever, like Dr. Christine said, is there to fight the body's infections. So we don't necessarily need to treat all fevers. If the child is comfortable and is happy, then it's not actually needed to treat the fever if it is not above 39 degrees Celsius. If it is above 39, or if the child is uncomfortable, then we do want to treat that fever. So just as a general rule for all fevers, if the child has a fever, it's important to give extra fluids because the child needs to be well hydrated. And then you can also make sure the child is not dressed too warmly, especially if they're under a year of age, because if they're over a year of age, they don't regulate their temperature so well, and they can overheat more easily than other children. So the next thing that's important is resting. So if the child feels like resting, then you can let him lie and not play as much as usual. But the moment that the child starts to feel better and he feels like they want to play, then they can start playing again. Then you can sponge the baby down with lukewarm water. Normally, it's not necessary. So first we recommend that you give some antipyrexial medicine, and then if the fever is still high, then you can consider doing the lukewarm water sponging. And basically what you do is you put them in a bath and make sure that the water is lukewarm. So about 30 degrees if you want to measure it. And then the moment that they start shivering, you can take them out of the water, or you can just make the warm water a little bit warmer. And then if all of that has happened and the child still has a fever, then we can move on to the medicine that you can give them. So mainly we start giving them fever above 39, but once again, you have to look at your child. If your child is uncomfortable, if your child is miserable, then you're more than welcome to give him something for the fever. So normally we start with a paracetamol product such as Panado or Calpol. You can give that every 4 to 6 hours, and it's important to note that you should actually work more with the weight of the child than necessarily the age of the child. Because as we all know, different children of different ages can weight can quite vary. So the other products that we can use is the anti-inflammatories, which we most probably know as Nurofen, the Brufen category, and that can be given every 6 hours. And that should not be given to children under 6 months of age. And once again, it should rather be calculated on the weight of the child. The fever medicine will take the fever down by about 1 to 1.5 degrees Celsius. So it might not necessarily take it down to normal. And it will take about 1 to 2 hours before you see any effect. The most important thing to remember is please not to give any child aspirin, as it's got a risk of causing Reye syndrome, which is a rare but very serious brain disease. Then there's different opinions out there about mixing and different medicine. I normally tell my parents that if you want to, you can give one first, a paracetamol or a Brufen, and then in about 1 to 2 hours, if the fever isn't down or if the child is still very uncomfortable, then you can alternate it with one of the other ones. But then you just need to remember which one you gave at what time, and make sure that you give paracetamol to paracetamol 4 to 6 hours between, and then Brufen to Brufen you should give 6 hours apart, so that you don't get confused and overdose the child. And then make sure that you're not giving any other flu medication with it that might have some paracetamol in that you're not familiar with. And then just to mention, a child can go back to school if the temperature has been normal for 24 hours or more. And remember, fever doesn't really cause pain. So if the child has pain, then make sure you give him something rather than not giving him something.
Please tell us more about the causes of fever in children. How are you to know if it's teething, a stomach bug, or the flu? Dr. Venter, if you could help us out first.
Okay. Yeah, so for the causes of fever, so the most common cause is infections. And of these infections, viral infection is by far the most predominant. Viruses cause 10 times more infections than bacteria. And then those ones don't need to be treated with antibiotics. So usually with a viral infection or a bacterial infection, there will always be symptoms, or most of the time there are symptoms associated with it, like a snotty nose or a runny tummy, vomiting, sore throat. But other signs are that they may be like a little bit lethargic. They're not as playful as they were before. They're not eating as well. They're a little bit more clingy. So those can all be signs of infections as well, obviously depending on the age of the child. So the younger they are, the less specific the symptoms are. And as they get older, they have a little bit more specific symptoms. So infections are by far the most common cause. Another common cause is vaccinations. So the vaccinations will usually cause a fever within 12 hours, and it might last for 2 to 3 days. Not all babies will have fever after their vaccination. So I know some sisters recommend that you must give, as a routine, give a Panado or something 4 hours after the vaccination. But I would usually recommend just to wait and see how your baby responds. Maybe your baby is one of those that don't have a fever, and then you don't have to give medication unnecessarily. So vaccinations, other causes of fever might be heat stroke, and there are some other thermoregulatory disorders as well. If your child has had a fever for more than 2 weeks, hopefully by then you would have taken them to the doctor in any way. But some infections can cause like a prolonged fever. Then also some autoimmune conditions like inflammatory bowel disease or lupus. Some types of cancers can also cause a persistent fever. But like I said, if your child has had a fever, usually we say more than 3 to 5 days. Rather take them to the doctor just to have a checkup and some investigations done.
I know that teething is a bit of a contentious issue. There has been research done, and they say that they're not, the jury is still out there. They don't think that high fevers, especially fevers above 39, can be caused by teething alone. So if you're not too sure why your child has a fever, even if she is teething, rather take her to the doctor if the fever is above 39 degrees and persisting, so that we can make sure that there's no other causes of the fever.
If your child has a fever once a week with gastrointestinal symptoms, I would recommend that they see their doctor just to see if there's maybe not like some underlying condition that is contributing to that.
Dr. Wessels, Sunay would like to know if you could please give the dosages for weight for the most common used medications, or a useful app that she can use.
I think I can give you a bit of a guideline. So Panado, the paracetamol one, is normally 10 milligrams per kilogram. So you need to know the weight of your child first. And then you just need to make sure what is the milligrams per mol, because there's 120 milligrams per 5 mol. So you need to do a bit of a calculation there. So that is the Panado one. And then for the Nurofen, they say about 5... wait, let me just check here for you. Yes, 5 milligrams per kilogram, and that's every 6 hours. So that is per body weight that you need to work it out.
Thank you. Next, we have Kirsty. Kirsty, you can unmute and direct your question.
Thank you very much. So I know that the fever is obviously because of some kind of an infection, and I've just noticed that ever since I've sent my child to daycare, the fevers are just kind of rolling in harder and faster. So I just wanted to find out if there was perhaps some kind of a good multivitamin, or I know there's a lot of like the whole crash guard, is something like that, is it worthwhile, and would it actually help to ensure that my child picks up less infections, resulting in less fevers?
Okay, so there's actually no evidence to support that multivitamins will prevent infections. Doctors usually refer to multivitamins as very expensive urine. But if your baby does have a shortage of something, then it might be useful. There's some studies that show that if you take vitamin C actually before you get sick, it might help a little bit. But once you have symptoms, vitamin C doesn't actually help to relieve symptoms. There's some studies that shows that zinc, if you are sick, especially with diarrheal illness, then zinc might help to resolve the symptoms a bit quicker. But so there's not actual evidence to show that multivitamins helps.
There isn't really anything that you can give your children except vaccines. So vaccines is the only way that you can really boost your child's immunity.
Now, Haley would like to know, what should one do when your child suffers from seizures due to fevers, or oorstepe, as they would say in Afrikaans? Dr. Venter?
Yeah, so the general recommendation for anyone that has a fever, a febrile seizure or any type of seizure, is just to turn them on their left-hand side and wait for the seizure to resolve. Don't put your finger in their mouth. You can just move stuff away from around them, like so that they don't bump their head, and then you basically wait for it to pass. It's usually a few minutes. Probably when it's happening, it feels like hours, but try to check the time to see exactly how long it lasts, if it's 1 minute or 3 minutes or 5 minutes, and try also to observe what the child is doing.
I think it's also just important to note that a child that's prone to febrile convulsions doesn't necessarily have to wait until the fever is 40 when they get the febrile convulsions. They can get febrile convulsions at 38 degrees. So a child that's prone to it will get it more frequently, not necessarily even with high fever. So if your child has not gotten any febrile convulsions by age 3 to 4, the chances of them of getting it afterwards is rare. So normally it's children that's quite prone to febrile convulsions.
Now, Crystal Dupree would like to know, or states, when taking my son's temperature with the ear thermometer, one ear is always more than the other. Do you go with the higher one, with the higher temperature and the higher ear, or do you get an average?
I would use the average. And then if the child's one ear is higher than the other ear, we always say that there might be an infection as well. So if it's not varying too much, I would go for an average. But if the one is much higher than the other one, then I would be concerned for an ear infection.
Thank you to Dr. Venter and you, Dr. Wessels, for the invaluable advice and guidance shared today.